All right, Raj, you get the first crack at this one. Polls show that Americans, and especially Kansans, overwhelmingly do not support the recently passed Federal Health Care Act. However, Americans also see the need for drastic reform of health care, both in terms of cost containment and accessibility. What is your plan for the American health care system?
Well, I think the health care law and the process that led to its passage exemplifies the worst of Washington right now, and is one of the reasons I'm running for Congress. Rather than work, as I've done, across the aisle in a bipartisan way, beginning with where we have consensus on key issues and expanding from there. For example, both parties going into the health care debate said, we agree that we need to end discrimination against patients with pre-existing conditions. We need to help Kansas seniors close the donut hole on prescription drugs. And we also should let young people stay on their parents' coverage till age 26. That these were common sense ideas that help Kansans. Rather than start there and grow and see where we could get common areas of consensus, we had a my way or the highway attitude from the majority, backroom deals, a lack of transparency, and I think we had, frankly, a lot of times rank obstructionism from the minority party that said there was going to be political points scored rather than dealing with this crippling healthcare crisis that is affecting all of you in this room and everyone at home. My view moving forward is simple. Repeal the parts of the bill that do not work for Kansans, such as the so-called 1099 provision many of you are familiar with, but keep the parts that do work for Kansas, that provide good, increased access, and lower costs for Kansas patients and providers.
Mike, 60 seconds again. What is your plan for the American healthcare system?
Wow, 60 seconds, American healthcare system. How about that? All right.
I think 65.
Yeah, thank you. Look. I think the healthcare law that was passed back in March is a disaster for America. It's a disaster for patients, it's a disaster for physicians, it's a disaster for insurance companies and physicians and medical care providers and pharmaceutical companies, and certainly for job creators. Certainly for folks who are thinking about where am I going to hire my next employee, we went the wrong direction. We moved our country close in the direction to nationalizing our healthcare system. We will have Kansas public exchanges where as many as 1 in 4 Kansans will be on Medicaid. And it's going to break the bank. We've got to undo it. You know, my opponent talks about being bipartisan and yet voted with Democrats 93% of the time. He talks about healthcare being too rancorous because the Republicans who couldn't vote with him, and yet the Democrats had plenty of votes to pass that legislation. They owned both houses and the presidency. And it was put forward by a president that he stumped all over the country to get elected. Those are very different views. Those are very different ways of thinking about healthcare and free markets and solving what is an absolutely serious issue in our healthcare system.